MASTER and CLIC are two parallel open label observational studies that are taking place in the United States. And they're designed to really look at the safety, efficacy, and patient perspective using patient-reported outcomes of individuals in the U.S. who are switching onto Cladribine tablets. The difference between the two studies is that the CLIC study is focused on those individuals who are switching from injectable medications like glatiramer acetate or a beta interferon. Ofatumumab was not available at the time that this study was designed, so isn't included onto Cladribine. Whereas MASTER is focused on those individuals switching from an oral therapy or an infusion therapy onto Cladribine. MASTER and CLIC is this poster presents an interim analysis from both MASTER and CLIC, and it looks at a total of 233 patients from the studies. For the CLIC patients, all of them have reached at least 6 months of follow-up. For the MASTER patients, we included everyone who was enrolled at the time of the data cut. So, the main information that we provide are some patient demographics that gives you an idea of who in the United States has started on these therapies. We also present a little bit of data on what their MS disease course looked like prior to starting onto Cladribine, because we think that'll be important when we compare their efficacy results. It's too early at this point for us to have efficacy results, but we do have a safety analysis. And thus far, when we look at all of the patients who have received Cladribine, so the 233 patients in this study, we don't see any new safety signals compared to what we saw in the clinical development program. This is especially important because in our original MAVENCLAD studies, the individuals were mostly treatment naive or were coming from the platform injectable drugs. So we wanted to ensure that there weren't new safety signals when patients were coming from the oral therapies or the infusion therapies onto MAVENCLAD. And then when it comes to patient adherence, which is something we're also very interested in, pleased to report that we saw very high patient adherence rates through the first year of therapy in this cohort of individuals. In fact, we actually saw that more than 96.5% of individuals in both studies completed the full course of Cladribine for year one. And that's a very high value compared to what we normally see with oral therapies. And I think some of that actually gets at the unique posology of MAVENCLAD. So I'm not sure how familiar you are with Cladribine tablets, but it's dosed in such a way that a person would only get a maximum of 20 days of treatment over the full 2 years. So that patient is only taking 10 years of treatment during year one. And I think that speaks to why patients are able to adhere at such a high rate, and therefore able to really get hopefully get the full benefits of the medication over that period of time.